So today I'm going to be talking about Down syndrome. I chose this because I knew a little bit about Down syndrome, but not a lot, so I really wanted to learn more about it. And after doing this project, I definitely did. So Down syndrome is a lifelong condition in which a person has an extra chromosome. And from this project, I actually learned there are 3 different types of Down syndrome. So chromosomes are located in the nucleus of each cell. The DNA is packed into a thread-like structure, which is called a chromosome. And we're going to watch a short clip before we get really into it.
Down syndrome is a special needs disorder caused by an extra full or partial copy of chromosome 21. It is the most common genetic disorder with 1 in 691 births in the U.S. alone. This is a karyotype of a person with Down syndrome. Signs and symptoms include low muscle tone, upward slant of the eyes, short stature, intellectual and/or developmental delay, sensory disorder, difficulty with speech due to a lowered mandible, associated heart and/or thyroid disease. Common treatment options include many forms of therapy, including physical therapy for muscle development, occupational therapy for activities of daily living, sensory integration for sensory processing, and speech therapy. Hearing aids and glasses are also commonly used. Medications are only used to treat symptoms associated with Down syndrome, such as heart or pain medication, or a diuretic for congestive heart failure. Homeopathic medicine would include special needs education.
Alright, so I'm not going to repeat much that she said because I think that was a really informative video. And I just wanted everyone to get a better idea of what I was talking about. So the first type of Down syndrome that I learned about was trisomy 21, and it's the most common form of Down syndrome, and it means that there's an extra copy of chromosome 21 in each cell, and that's why it's called 21. The next one is mosaicism. It's less severe than trisomy 21, and this occurs when a child is born with an extra chromosome in some but not all of their cells. And the last one is translocation, and it gets its name because children with this have an extra piece of chromosome 21 attached to specific chromosomes, but not all of them. So Down syndrome is not curable. It is a lifelong condition, and there are different ways to treat challenges that children may be facing because of Down syndrome, but there is no cure. Down syndrome is actually the most common chromosomal condition diagnosed in the United States. And trisomy 21 accounts for 95% of all Down syndrome cases. And 1 out of every 700 babies born in the United States is estimated to have this condition. And I got this from Healthline. Some common physical features in Down syndrome is a flattened face, especially on the bridge of the nose, almond-shaped eyes that slant up, a short neck, small ears, a tongue that tends to stick out of their mouth, and I didn't know this one, but they can have tiny white spots on the iris, which is the colored part of their eye, small hands and feet, a single line across the palm of the hand called the palmar crease, small pinky fingers that sometimes curve toward the thumb, poor muscle tone or loose joints, and shorter heights when they're children and adults. Diagnosing Down syndrome can be done in several different ways. They can actually test it when the baby is still in the mother's womb by doing a biopsy of the placenta at 10 to 12 weeks gestation. And this is called chronic villus sampling, or CVS. Or you can do another one where they get a needle and it gets a sample of the amniotic fluid, and that's about 15 weeks of gestation. They can also look through an ultrasound and see if there are any markers showing within your baby's internal organs. And then lastly, of course, they can diagnose it with a physical exam or the blood test when the baby is born. Some medical complications due to Down syndrome is 50% of babies born with Down syndrome will have a heart condition. The risk of developing digestive problems, such as a GI block, is increased. Immune disorders are also increased. Sleep apnea is increased. Obesity, spinal problems, and even young children with Down syndrome are increased risk of leukemia. And people with Down syndrome have a greatly increased risk of developing dementia, which may begin around their 50s. So treating Down syndrome medically, the doctors, just like anyone else, are going to do the best that they can to help the patient out, especially if it's caused by their condition. They're going to try to do the best they can. Some physical and behavior things that are offered for Down syndrome children and adults is occupational therapy for motor skills, physical therapy, speech and behavior therapy. And obviously, educational wise, they do have the therapy and developmental services through state and federal programs. So some risk factors of having a baby with Down syndrome is if you're advanced in age. So if you're over 35 years of old, it is an increased chance that you will have a baby with Down syndrome. Both men and women can carry and pass the genetic translocation Down syndrome down to their kids. So if you and your husband both have that genetic translocation, you can pass it down to your children. And finally, parents who already have a child with Down syndrome are more likely to have another child with Down syndrome. So unfortunately, there are no known environmental factors that cause Down syndrome or any way to prevent Down syndrome. So my takeaway from all of this is the fact that just because you have a child with Down syndrome or they're adult does not mean anything bad. They actually live longer than what they used to because of medical advancements, and it doesn't mean it's the end of the world. There are a lot of people that have Down syndrome that sometimes it can be less severe, more severe, but they have jobs, they get married, and even have children. And this is my reference page. Thank you so much.